growing concern in Malaysia, with 48,639 new cases reported last year alone. Lung cancer in particular present a pressing issue, with nearly 95% of cases detected late, according to Dr. Muralidharan Munisami, Managing Director of National Cancer Society Malaysia. This concern extends to non-smoking women who are increasingly affected due to a factor like second-hand smoke exposure. Lung cancer screening, while available, is not widely utilized, especially by smokers who are at the highest risk. According to World Health Organization, or more known as WHO forecast, Malaysia could see a doubling of lung cancer cases by 2040, with smoking being a significant risk factor. The incidence of lung, trachea, and bronchial cancer is higher among males, particularly in individuals aged 60 to 74, which approximately 93.5% of cases diagnosed at late stages. So among females, 92.3% of cases are detected late. Globally, the Global Cancer Observation (GlobalCan) 2020 report reveals over 2.2 million lung cancer cases, with more than 770,000 in women. Shockingly, there has been 79% increase in global lung cancer cases among women in recent decades, with the majority being non-smokers. In Malaysia, the 2018 Malaysia study on cancer survivor reported 2,478 lung cancer cases in women, among half the number in men at 5,543, despite the lower rate of tobacco use among Malaysian women. Non-smoking women who develop lung cancer also tend to be younger, emphasizing the need for heightened awareness and early detection strategies address this concerning trend. Based on the data presented in this graph, it is evident that the estimated total number of cases in 2012 was 4,403, increasing to 4,686 by the year 2018. Nevertheless, the graph displays a notable increase in cases estimated for the year 2040.
The chronology of cancer. Cancer is formed by a process known as carcinogenesis, where normal cells are transformed into cancer cells. Carcinogenesis is divided into 4 distinct stages. The first stage is tumor initiation, where normal cells are changed so that they are able to form tumors. This is followed by the second stage, tumor promotion, which is a process where existing tumors are stimulated to grow and expand in number. The third stage is malignant transformation, where the tumor-forming cells acquire the properties of cancer. There are 2 different types of lung cancer, which are small cell and non-small cell lung cancer. Each has different stages, but both are initially diagnosed with similar staging system before using a staging system specific to each type. This shared staging system is known as the T&M system. The T stands for tumor, which shows the size of the tumor and its location in the lungs or body, whereas N stands for node involvement, which indicates whether the cancer has spread to the lymph nodes near the lungs. Finally, M stands for metastasis, which shows whether or not the cancer has spread to other parts of the body. For small cell lung cancer, after diagnosis with the T&M system, it is classified into 2 different main stages. The first stage is known as limited stage, where cancer is localized in only one lung and has not yet spread to both lungs or elsewhere in the body. The second stage is known as extensive stage, where the tumor has spread to other areas of the lungs and chest. It is either widespread throughout one lung or has spread to the other lung. It could also spread to the fluid around the lungs known as pleura or to other organs like the brain. For non-small cell lung cancer, which is more common than small cell lung cancer, it is staged into a total of 6 different stages after diagnosis with the T&M system. The first stage is known as the occult stage, where cancer cells can be picked up in mucus coughed by patient, but the tumor can't be seen on imaging scans or biopsies. This stage is also known as hidden cancer. The next stage is stage 0, which is also known as in situ cancer. The tumor is very small as it is located in the top lining of the lung or bronchus. Cancer cells have not yet spread into deeper lung tissues or outside the lungs. This stage is followed by stage 1 cancer, where the cancer is located in the lung tissues but not the lymph nodes, does not spread outside the lungs yet. Next, stage 2, where the cancer has grown larger than in stage 1 and may have spread to lymph nodes inside or near the lungs. Then, stage 3, where the cancer grows larger and spreads further into the lymph nodes and into the middle of the chest. Finally, stage 4, where cancer has spread to both lungs and spread widely elsewhere around the body, such as in the brain, bones, liver, or other distant organs. What's wrong with
Nothing important.
I see. And that was tiring.
Yeah.
I feel so stressed, you know. All these assignments, so much to do, so little time.
So much to memorize.
Yeah.
No, I have a way to deal with this.
Oh, really?
No.
So you heard about what happened the other day?
Oh, what happened?
Yeah, the football team, guess who won? Nah, try harder.
Hari kemana ya?
Yeah, that's right. I'm on rice for the win, baby.
This way.
Yeah.
Several months later.
What's wrong?
My chest is in pain, and I'm also coughing blood.
Do you have your IC?
Here.
Oh, I see. Okay. May you wait here first?
But I can't. It's an emergency.
Sorry? Hi, you look very ill today. What's troubling you today?
Doctor, for the past few months, I have been coughing non-stop lately.
Are there any symptoms?
Persistent coughing is a significant indicator of lung cancer. Changes in the pattern of your cough are also a red flag. If you have been a smoker and suddenly develop a dry cough or a cough that produces blood-tinged mucus, it could be a warning sign of lung cancer. Chest pain is another symptom to take seriously. Persistent pain in the chest area, particularly when coughing or gagging, could be a sign of lung cancer. Shortness of breath or wheezing, especially if it's not related to exercise or a respiratory infection, might indicate lung cancer. Loss of appetite and unexplained weight loss are also common symptoms. If you have been eating normally but still experience significant weight loss, it could be a sign of a more serious underlying issue such as lung cancer.
I think I have a bad news, but first I have to run a CT scan on you and bronchoscopy and biopsy. So you can follow her.
Yeah, follow me, yeah?
A few moments later.
Doctor, so here's the result.
Thank you. Based on this result, I'm so sorry, Wafi. You have an early stage of lung cancer.
But doctor, is there any treatment for this?
Of course, there are many treatments of cancer. So first, usually lung cancer patients will be treated with surgery, where we will remove cancer from your body. But the surgery is usually done for non-small cell cancer, and SCLC that hasn't spread, and small cell lung cancer that's limited to a single tumor only. Lung cancer patients will also undergo chemotherapy.
Chemotherapy? What's that? Sounds dangerous.
Chemotherapy is a treatment where the cancer cells will be stopped or slow by using anti-cancer drugs. However, it kills or slows down the growth of cancer cells that leads to other side effects such as hair loss, nausea, and also mouth sores. And we also have immunotherapy.
Immunotherapy? I heard that the immune system recognizes harmful cells and eliminate it.
Yes, you're right. But cancer cells have ways to avoid the destruction by the immunity system. Cancer cells have proteins on their surface that turn off immune cells. So, immunotherapy can help the immune system to better fight against cancer. Besides, some cancer patients with an SCLC will also be treated with targeted therapy. This therapy works by targeting and interfering with specific proteins that control how cancer cells grow.
Is that so? So, doctor, are you going to give me an appointment?
Yes, I will arrange another date for you to see me. Okay, so here's the date that you have appointed that you have to see me.
Okay. Thank you, doctor.
Thank you.
Hey,
Yes. Oh my god, I've been ready to eat sweets, especially cake one day. Do you want some?
well, I think I'll pass for now. See, you know, it's quite nice to get bunny and all, but when we eat, we should make sure we have enough nutrients for our food. I've been trying to go on a diet, so I got myself some rice, chicken, and salad. My carbohydrate, my protein, and my fiber. I read somewhere that if you eat healthy, you will reduce the chances of having cancer.
So do you think I might get cancer by eating this cake one day?
No, I'm sure that chances are a bit too low for that. But if you eat it too much, well, you could have health complications.
Yeah.
Hey, sorry.
Oh, see.
Want to do the usual thing?
You see, Wafi, thing is, I do not wish to smoke anymore. I just want to be happy.
Why to do that?
Wafi, have you watched the news?
News?
Yeah.
What year is it?
According to who? If we smoke, we are at risk of developing lung cancer. Yes, it's true. We may be stressed. But what is it relieving our stress if we die early because of that?
Oh, come on. A packet or two is fine. No?
No, Afi. This is not the way.
Do you want to join me for another round?
Thanks, Shifa. I think we are busy.
Yes, we're on tournament. It's very important, you know. Okay, but do you know that exercise can prevent lung cancer?